If you're worried about a heart attack, and if you clicked on this video, you probably are, there's something you need to know. You've been told the warning signs are about pain. They're not always. Your body starts warning you before the pain ever arrives. Through smells. 6 specific smells that most people notice and walk right past because nobody told you what those smells mean. Know them, and you have a real chance to act before it's too late. Let's go through all 6. Starting with the one that sounds strangest, and turns out to be one of the most documented. Have you ever noticed a faint metallic smell that you couldn't explain? Not from anything you touched, not from food, just there, in the back of your throat or your breath, like pennies or old iron. You mentioned it to someone and they said they couldn't smell anything, so you moved on. Here's what that might have been. When the heart muscle is under significant stress, when blood flow is reduced and tissue starts struggling for oxygen, the body ramps up a process called oxidative stress. This is what happens at the cellular level when your cells are working harder than usual just to keep going. One of the byproducts is a class of compounds called aldehydes. These make their way into the bloodstream and eventually into your breath. Research published in the journal Heart Disease documented that patients with unstable angina, a condition where blood flow to the heart is critically reduced, had measurably higher levels of specific aldehydes in their exhaled breath compared to healthy controls. The smell those compounds produce has been described consistently as metallic. Now, before you panic, and I want to say this clearly, a metallic taste or smell has many causes. Iron supplements, certain medications, sinus infections, dental problems. On its own, it means nothing. What matters is whether it is new, whether it is unexplained, and whether it is accompanied by any of the other signs we are going to discuss. That is your filter throughout this entire video, not one sign in isolation. The pattern. The second smell is one that most people associate with something else entirely. Fruity, sweet, almost like nail polish remover or overripe fruit. If you have ever noticed this on your own breath without an obvious explanation, this is worth understanding. That smell is acetone. Your body produces it when it switches to breaking down fat for energy, a process called ketosis. If you are deliberately following a low-carb diet, this is expected and harmless. But in someone not changing their diet, a sudden acetone smell on the breath can indicate that the body is shifting its energy production in ways it should not be. Research into exhaled breath analysis has found that metabolic changes related to cardiovascular stress can produce detectable shifts in breath composition, including acetone levels. The heart muscle, when it is not getting adequate blood flow, changes how it produces energy. Those changes can appear in your breath before chest symptoms develop. If this smell appears and you have not changed what you are eating, mention it to your doctor, not an emergency call. But worth saying out loud, 2 signs in. Neither of them the chest pain you were told to watch for. Keep going. The third one. I want you to try something right now. Go get something with a strong, familiar smell. Coffee, cinnamon, a candle you know well. Anything with a distinctive scent you have known your whole life. Smell it. Is it as strong as you remember, or does it seem quieter, muted, like the volume on a radio that someone turned down slightly and you cannot find the dial? Here is why this matters for your heart. A study published in the Journal of the American Heart Association followed 2,537 adults aged 70 to 79 for up to 12 years. People with measurably reduced ability to identify familiar smells had a 30% higher risk of developing congestive heart failure compared to people with a normal sense of smell. Now, and this is important, the study found this link specifically with heart failure, not with heart attack directly. The researchers were clear that the relationship needs more investigation, but what they understood was this. As blood vessels change and circulation becomes less efficient, the tissues that support our sense of smell can be among the first affected. Olfactory decline may be one of the earliest observable signs that something in the cardiovascular system is changing, before more dramatic symptoms appear. So, if your sense of smell has clearly changed and it is not explained by a cold, allergies, or a medication, bring it up with your doctor. Your nose may be noticing something your heart has not announced yet. The fourth smell is the one I find most striking to describe, because when I explain it, a certain number of people watching this video will realize they have already experienced it and dismissed it. Some people describe a sudden, intense smell of something burning when nothing is burning. Not smoke from outside, not toast. A burning smell with no source, appearing out of nowhere and disappearing without explanation. This is a recognized neurological phenomenon called phantosmia, a phantom smell produced by the brain itself. When blood flow to certain brain regions is temporarily disrupted, the olfactory cortex can generate false signals. The result is a smell that feels completely real, but has no external source. Burning is the most commonly reported type. A woman I read about in a case study, 67 years old, healthy by every measure she knew of, smelled burning for about 20 minutes while sitting in her kitchen with nothing on the stove. Her husband confirmed there was no smoke and no source. She dismissed it as one of those inexplicable things that happen sometimes. 4 hours later, she was in the emergency room with a confirmed cardiac event. She survived, but she said afterward that she wished someone had told her that a burning smell with no source was something her body was capable of using as a warning. This is that someone telling you, if you smell burning and there is nothing burning, especially if it lasts more than a few minutes, especially if you feel even slightly unusual alongside it, do not wait to see if it passes. Call someone. The fifth sign is one people find embarrassing to mention, which is exactly why it so often goes unmentioned. An unusual, sharp body odor, different from normal sweat, more chemical, more pungent, that appears suddenly and is not explained by exercise or heat. There are two different kinds of sweat glands. The ones that activate when you are warm produce mostly water and salt, ordinary perspiration. But there is another type, the apocrine glands, that activate specifically in response to stress and fear. Stress sweat is chemically different. It contains higher concentrations of proteins and lipids, and when the bacteria on your skin break these down, the resulting smell is distinctly more pungent and chemical than ordinary sweat. When the body senses a cardiac threat, even before you consciously feel anything, the sympathetic nervous system activates. This is your body's emergency system, responding to danger before your thinking mind has processed what is happening. One component of that response is those apocrine glands activating. Your body is recognizing the threat. The smell is the reaction. Family members of cardiac patients have described, in documented observations, noticing an unusual body odor in the hours before their loved one's event. It is not universal, but it is consistent enough that it belongs on this list. If you notice a sudden unusual body odor, not from exertion, not from heat, not from anything you did differently, especially alongside even a vague sense that something feels off, take it seriously. The embarrassment of mentioning it is nothing compared to the alternative. The sixth brings us to something very close to home for many people. Breath that smells different, not bad breath from food or dental hygiene, different in a way that is hard to name, often described as stale, slightly chemical, or heavier than usual in a way that has no obvious explanation. Research into exhaled breath as a diagnostic tool has identified volatile organic compounds that shift when the cardiovascular system is under stress. The field is still developing. Breath analysis is not yet a standard clinical tool for heart disease, but the consistent finding is that cardiac stress produces measurable changes in what you breathe out. Changes that people close to you sometimes notice before you do. A persistent, unexplained change in how your breath smells, new, not related to food or oral hygiene, noticed by you or someone who knows you well, is worth paying attention to alongside anything else on this list. 6 signs. A metallic quality to your breath. A sweet or fruity note without dietary explanation. A sense of smell that has quietly dimmed. A burning smell with no source. An unusual stress-related body odor. And a breath that smells chemically different from usual. Before I tell you what to do with this, let me say something clearly because I do not want you to finish this video in a state of panic. None of these, on its own, means you are having a heart attack or about to have one. Every single one of them has other explanations: medications, infections, aging, diet, normal variation. If you have occasionally noticed one of these without anything else unusual, that almost certainly means nothing. Your filter is this. Is it new? Is it persisting? Is it happening alongside anything else? Unusual fatigue, shortness of breath that surprised you? A general feeling that something is not quite right even if you cannot name it? Are the people around you noticing something different? New, unexplained, persistent, accompanied by even a vague sense that something is off? That is when any of these smells becomes worth acting on, not panicking about. Acting on. There is a real difference. The people who do best after cardiac events are almost never the ones who happen to be in perfect health beforehand. They are the ones who paid attention early, who mentioned something inconvenient to their doctor while it was still embarrassing to do so, who did not wait for the crushing chest pain because they had learned, or someone had told them, that the chest pain is not always the first thing that arrives. It does not mean you are getting bad news. It means you are giving yourself options. Time to ask questions, time to run a test, time to catch something before it becomes something you cannot catch. Your body is not quiet before a heart attack. It speaks. It just does not always speak in the language you were told to listen for. Now you know 6 more words in that language. If this felt relevant to you or to someone you love, share this video with them. And if you want to understand more about the warning signs that most people overlook, the video on screen right now goes exactly there.